Hi, my name is Dr. Steve Beyer. I'm a practicing chiropractic doctor in Frankfort, Illinois. I've put together this informational DVD for those people who are suffering with different autoimmune conditions to let them know of a very effective natural management approach which involves functional neurology and functional medicine. A little bit about myself before we dive in and talk about that. We're going to take, first off, about 35 minutes or so. A lot of information. You may want to even hit the pause button right now and go grab a sheet of paper and a pen if you're kind of a note taker, because we're going to cover a lot of information. Most of it you probably never heard before, and that's unfortunate. There's a lot of very effective management approaches for people who have different autoimmune conditions, and I utilize those in my practice. My practice is a little bit different than most chiropractic offices. Half of it is in the treatment of traditional musculoskeletal problems that you typically associate with a chiropractor, like back pain and neck pain and so forth. But the other half of my practice is it specializes in treating and managing people with different chronic conditions, such as thyroid problems, irritable bowel syndrome, and a variety of different autoimmune conditions that people suffer with. And I'm able to do that because I've taken a lot of extra training in the years since I've graduated. I graduated in 1994, so I've been practicing 18 years now to date when I'm taping this. But a lot of extra training over the years in different aspects of functional medicine, such as functional blood chemistry analysis and functional endocrinology, neurotransmitter assessing and balancing. I've taken a lot of extra courses specifically in the natural or functional management or treatment of thyroid conditions. And I also utilize functional neurology to treat or manage people's different chronic conditions. I am enrolled in a graduate program called the Carrick Institute at this point in time, which leads towards a diplomate status in neurology. Many people don't realize that chiropractors can specialize in different fields like medical doctors do, and that's an area of specialty in my office. Is I utilize functional neurology to help people with their different chronic conditions, and that's my approach is functional neurology and functional medicine for different autoimmune conditions. And that may not mean much to you now, but that's what this informational DVD is all about. So please just listen, because people with autoimmune conditions are really unnecessarily suffering, and that's because the medical approach is just really, it's really behind the times. It doesn't take into consideration the most recent research. It's pharmaceutically driven. It just really falls short for giving people hope and giving people relief for different autoimmune conditions. Whereas a functional medicine approach, especially when combined with optimizing the function of the nervous system with functional neurology or brain-based therapy, can really give people their lives back. And so please just focus in, again, 35 minutes or so. First off, autoimmune conditions. They're on the rise, unfortunately. They're increasing every year in the United States, and there's different autoimmune conditions. There's autoimmune thyroid conditions like Hashimoto's thyroiditis, which typically causes a low-functioning thyroid. There's Graves' disease, which is a thyroid problem that causes an overactive thyroid condition. There's rheumatoid arthritis, where the joints, the cartilage in the joints are getting attacked. Multiple sclerosis, Crohn's disease, which is an autoimmune intestinal problem. Scleroderma, the connective tissue, is getting attacked. Sjogren's, ulcerative colitis, sarcoidosis, vitiligo, lupus or systemic lupus erythematosus. There's a bunch more, but here's the thing about autoimmune conditions that you need to kind of understand to begin with. And I don't mean this, I don't say what I'm going to say to minimize the suffering that you're going through if you have an autoimmune condition. But the thing about an autoimmune condition is that autoimmune is autoimmune is autoimmune is autoimmune. And what I mean by that is that the name that they give for the autoimmune condition just depends on what tissue is getting attacked, but the underlying dysfunction of the nervous system is the same no matter what the condition is. There is just an imbalance of the immune system. The immune system, the different parts of the immune system have become imbalanced and are not working right, and as a result, there's an attack on some of our own tissue, which obviously shouldn't happen. Another thing that's important for you to understand as an autoimmune sufferer is that recent research has shown that if you suffer from an autoimmune condition, there is a 53% chance that somewhere on down the road, some other tissue is going to start getting attacked by your immune system. So what that means is that, say you have rheumatoid arthritis. Well, that's the name you've been given because your immune system is attacking the cartilage of your body. But there's a 53% chance that if it hasn't already, somewhere on down the road, your immune system is going to start attacking other tissues in your body. Or if you are a sufferer of Hashimoto's thyroiditis, where the thyroid gland is getting attacked, then likely 53% chance some other tissue is going to start getting attacked besides the thyroid. So it's super important, and this is the point in bringing this up, to regulate and modulate the immune system so that it's not so imbalanced, so that not only can you feel better here and now, which you absolutely can as an autoimmune sufferer, but so that you don't continue to feel worse because the condition or the problem just kind of ripple effects and you start having other tissues get attacked. There's no cure for an autoimmune condition. You can't take it away, but with the right approach, and I'm going to talk about a functional medicine and functional neurological approach, you can dramatically dampen the expression of that condition. It's the analogy I give for patients is that in a genetically susceptible person, okay, and that's kind of the beginning point, is that people tend to be genetically susceptible for an autoimmune condition. In a genetically susceptible person, once the light switch is turned on, in other words, once the expression of that predisposition genetically is manifested, then you can't turn the light switch off. But what you can do with the right approach is dramatically dim the light switch. With the right approach, it's kind of like having a dimmer on the light switch, and you can really slow down the attacks, really maximize the good days, minimize the bad days, and help people really get their lives back. And that's quite a bit different than the conventional medical approach, which really has very little to offer. And we'll talk about their approach a little bit, and just so you can kind of contrast it to a functional medicine approach that we'll talk about. You need to understand a little bit about the immune system. Not in depth, but just a little bit. Keeping it basic, there's two main parts to your immune system. I'm going to use the whiteboard here and there as we go through this next 35 minutes or so. The first part of your immune system is your immune system has different barriers, just protective walls that prevent things from getting inside of our body, including the bloodstream. And that just makes sense. We kind of swim through a sea of microbes, bacteria and viruses and so forth. Only the first line of defense is a barrier system. And then the other main part to our immune system is the white blood cells of our body. Now, in terms of the barrier system, there's four main barriers. Okay, there's four main kind of walls that our body has to prevent things from getting inside. And the first barrier system is our skin. Our skin is an important part of our immune system. It prevents just any old thing from getting into the bloodstream that could cause infections. The second barrier system that we have is our lungs. There's a filtration system in our lungs because we breathe in, as you can imagine, lots of things that, again, you don't want getting into your bloodstream. And so there's a filtration or a barrier system there. There's also a barrier system between the bloodstream and the brain because of how important nervous system function is. They call that the blood-brain barrier. And there's also a barrier system in our GI tract. Our intestinal tract is a very important part of our immune system. We ingest lots of things that, it's kind of gross to talk about, but you ingest a lot more little microbes than you would like to imagine. And our gut really prevents a lot of illnesses that we'd otherwise have by preventing those things from getting inside. In addition, there's lots of the gut's an important part of our immune system in the sense that it's a barrier system, but there's lots of other, really 70 to 80% of your immune system is in your GI tract, okay? So an important, or rather a proper functioning GI tract is really important for a proper functioning immune system. And the white blood cells, there's different types of white blood cells. And we're going to keep it simple, okay? And just give you kind of a crash course in immunology here. And there's a few main different types of white blood cells, and we name them as T helper cells. Okay, there are T helper 1 cells, and T helper 2 cells, and T helper 3 cells, which are sometimes called T regulatory cells, because the T helper 3 or the T regulatory cells help balance the activity of the T helper 1 and T helper 2 cells. In a normal functioning immune system, the activity level of Th1 and Th2 is pretty even keel. Th1 is kind of like the part of your immune system, or the type of white blood cells that initially respond to the presentation of an infectious agent like a bacteria or a virus. And so these are kind of like the frontline defenders, the T helper 1 cells are. The specific types of white blood cells are macrophages and natural killer cells, things like that. Whereas the T helper 2 cells is the part of your immune system that produces antibodies, which gives us long-term immunity. So you're infected with some bacteria when you're 6 years old and you're in kindergarten or first grade, and you, a little on down the road after a few weeks, you develop these antibodies via your Th2 system, so that when you're, in your 20s, 30s, 40s, if you get infected with that same bacteria or virus, you don't have a sickness to it, because your body has developed these antibodies and you attack it a lot quicker. And again, the T helper 3 cells, they help balance the activity level of the Th1 and Th2. And that's important because what happens with an autoimmune condition is, instead of the T helper 1 and T helper 2 activity being pretty even, you have this polarity between the two. You have, for example, an underactive T helper 1 part of your system and a dramatically overactive T helper 2 cells, or vice versa. Okay, it could be rather than a Th2 dominance, you could have a Th1 dominance with Th2 being underactive. The point is that that's what's happening with an autoimmune condition, is that there is this polarity or this imbalance between these parts of the immune system. Okay, and again, that happens in a genetically susceptible person, but why that happens is what we're going to talk about now. Okay, there are certain things that can, in a genetically susceptible person, trigger that polarity or that imbalance between the Th1 and Th2 systems. And we kind of generally break these down into two categories. Okay. One main general way that the immune system can become imbalanced like that is through some sort of metabolic dysfunction. I'm going to abbreviate here. And the other main way that the immune system can become imbalanced like that is through what we call an active antigen. Okay, an antigen is just a big fancy word for some sort of foreign invader into the system. And sometimes it can be a little bit of both. People can have some type of metabolic, ongoing, chronically unresolved metabolic dysfunction, such as chronic inflammation, okay, which is not uncommon, unfortunately, in our society because of what we call the standard American diet. The standard American diet has a dramatic imbalance between the pro and anti-inflammatory essential fatty acids. There's essential fatty acids from the foods that we eat that help quench inflammation, and there's essential fatty acids or fats from the food that we eat that help or actually promote inflammation. And in an ideal diet, you should have a 1-to-1 intake, but in the standard American diet, studies have shown that the intake of the pro-inflammatory